Hi, I'm Dr. Mike Milligan. I'm here with Dr. David Wong, trained at the University of British Columbia Dental School in Canada, Vancouver. Spent 21 years doing research at Harvard, and now the University of California, Los Angeles, doing research on salivary diagnostics, a very interesting, wonderful coming field for our patients. David, thanks so much for being with us.
Good to be here. Good to be here.
Tell us a little bit about what you're doing with salivary diagnostics, what that is in a nutshell, and then what that's going to do for our patients, because I'm really excited about it.
Good. So this journey of salivary diagnostic, the part that we were involved with, started 12 years ago.
Right.
And when I moved from Massachusetts to California, and at that time, the National Institute of Health, one of the 27 institutes at the NIH, the National Institute of Dental and Craniofacial Research, invested in the academic community to do one thing. And that one thing is to turn saliva into a clinical reality.
Fabulous.
And they did it in two parts. First is to identify what I call the first diagnostic alphabet in saliva, because prior to that time, we really don't know what's in saliva,
right,
except there's something there. And the proteome is what the NIH decided to invest in. Secondly is they also invested in developing technology, point-of-care technology, that could eventually allow clinicians and patients to take a drop of saliva and monitor these disease discriminatory information. So with that combination, the vision of the NIDCR is the day when a dentist, a doctor, a nurse, or a patient can take a drop of their own saliva and monitor their health. Right. Or is there an onset of a disease, whether it's periodontal disease, oral cancer, diabetes, or life-threatening conditions.
Right.
So the overarching goal here is that is to turn saliva into a clinical reality that affords this non-invasive means of monitoring health and diseases. The holy grail of diagnostic is non-invasiveness.
Sure.
There's no other body, component better than the saliva to fulfill that.
Well, what's exciting to me is I get a quarterly blood test, blood and urine test, because I'm a patient at the heart attack and stroke prevention center. Don't want one. That's what my father and uncles died from. So I get a blood test. They take about 7 or 8 tubes of blood every quarter. Well, if I could do this just by using my saliva instead of the blood, urine, or even for some diseases we look at spinal taps and things like that, how much less invasive and easier and more comfortable it is if you can just do that with saliva. And that's what you're talking about.
Indeed. Now, I'm not here to...
Not for everything, but for some things.
I'm not advocating replacement of blood. Blood is great. Blood chemistry is there to stay. There's no question. But there are areas that we now know that saliva shines.
Right.
And
well, that's what I'm talking about.
That's on the detection of diseases, especially cancer, early detection of cancer, which is really the key to outcome and survival and morbidity.
Okay. So at this time we're looking at certain types of cancers. Any in particular? So
in my lab per se, we are embarking on a number of cancer that are non-oral. Obviously we're working on oral cancer.
Right.
But systemically, we're working on lung cancer, breast, gastric cancer, stomach cancer, as well as ovarian cancer.
Okay. Did I see pancreatic cancer
yes,
as one of
indeed,
them as well?
Indeed.
Okay.
We focus on these notoriously difficult, lack of early detection cancer, and to really ask the question, are there molecular constituents in saliva of these patients that could detect this disease before clinical manifestation of symptoms?
Now, this isn't a reality yet. About how long are we looking at before this is going to be a viable, credible procedure? diagnostic procedure?
So there's a timeline to this. It depends on each of these diseases working on, and other people working on it as well.
Yeah.
Oral cancer should be about within 2 years from clinical reality. That I mean from regulatory approval and then being either through a commercial laboratory or a point of care evaluation for risk assessment.
Right.
Systemic disease-wise, my timeline is about 5 years for gastric cancer, and perhaps also 5 years for Sjogren, the dry mouth conditions that many of our patients suffer from, primarily women.
Right, wonderful. So simple saliva test. What does the test look like? What are you doing? You're just taking a swab? You having a swish and spit with a solution? What are you doing?
So basically that, is collecting a saliva sample either in a dentist's office or eventually at home, and then that sample could be evaluated, either using a point of care, capability, which we develop and others as well, or send it into a reference lab, LabCorp or Quest Diagnostics or others.
Sure, okay. Once we've done this with cancer, several different types of cancers, not all cancers, but the ones that you mentioned probably, right? Okay, well, then where do we go with it? What do you see the future after that with salivary diagnostics?
So the most important element that we need to be cognizant of is scientifically credentialed saliva markers for disease detection, especially for systemic diseases, because that bar is so much higher and those opportunities are so much broader should that become a clinical reality. And once that is credentialed, I think the list is endless.
It opens the floodgates to look further.
In addition to detecting diseases, the flip side of it, the other side of it, is monitoring health.
Sure.
And what better capability to have a non-invasive biofluid that you and I produce a liter to a liter and a half a day. That's 3 bottled water a day, constantly coming to our oral cavity, non-invasively, non-painfully, and non-embarrassingly, that we can monitor. Monitoring personalized health is a reality now. The iWatch is 6 months away. The iWatch is something that you can talk into and monitor your health. And this wearable gear, the monitoring your health, is coming very quickly.
Wellness is certainly the key.
Indeed.
We need to go from the treatment model, once you get disease, treating it, to preventing it. And early detection also. And it sounds to me like the salivary diagnostics, you can certainly detect earlier by using this.
Indeed.
And therefore treat earlier and less invasively with less problems.
Indeed. That's a holy grail of diagnostics. It's non-invasiveness, early detection, and as a profession we're blessed by this capability, but now we have that opportunity to scientifically credential it.
Right. By credentialing it, you mean verifying it, doing the research you're doing over the next few years to absolutely verify that this is credible and a valid diagnostic test. Is that correct?
Indeed. To take these markers and advance it towards regulatory approval. Nothing short of regulatory approval, and then scientifically credentialing it that how a distal organ like the pancreas that you mentioned, when it's diseased, can shuttle information through our vasculature, reach our salivary gland, and come into saliva. That reflects the distal disease.
You mean the mouth really is connected to the rest of the body?
No question. No question. Absolutely.
Obviously it is. Yeah. So, is there any last things you'd like to tell us, Dr. Wong, before we close?
So I'm very glad to be here. I think this organization is just amazing. Its advocacy, and I'm very privileged to be engaged in the research that we do. If what we do, I think clearly echoes that sort of mission of the AOSH, that the oral systemic connectivity. Whether the pancreas is connecting to the salivary gland, whether it's AT&T, Sprint, or Verizon, we can't see it, but it doesn't mean they don't connect. So we have that opportunity to credential it, and once we can do that, then I think it really would put our profession, dentistry, at par with our medical profession. The day can even come that dentistry, through this risk assessment of systemic disease, could put us at the front line of primary health care. That's a day to look forward to.
Absolutely it is. How can we follow what you're doing? Where do we get information as you progress through?
So us and others are engaging in this.
Is there a website?
My lab is you can just look us up at David Wong, UCLA Salivary, and you'll find us there. And we have a very, very nicely assembled website that's very illustrative of what we do, where we came from, and what we look forward to.
Wonderful, David. Thank you so much.
So glad to be here.
Great.
Really, thank you very much.